Welcome, everybody, to healthyseminars.com. My name is Lauren Brown, and I am the president of Healthy Seminars. I'm also the clinical director of AccuBalance Wellness Center in Vancouver, British Columbia, Canada. I'm going to do some quick housekeeping, and then Sharon Weizenbaum is going to introduce our speaker and topic today. We are at the Classical Chinese Herbal Principles in Action to the Virus That Cannot Be Named series. And I want to just do really quick housekeeping because we've been doing this a lot. So hopefully the new people need this. Most of you know this. We have a resource page on the homepage halfway down. So here's the homepage of healthyseminars.com. The actual URL is healthyseminars.com/resources. If you go to the homepage and click on that logo, it'll take you to the resource section, which we keep adding stuff to and organizing it. So here's where you can see the Classical Herbal Principles in Action. We have a calendar of events for the week. We're going to put a full calendar up here soon so you can see what's happening on a daily basis for both this free content as well as CEU PDA approved content. And then when you go down, you can find a link and it will take you to the actual page for replays. For example, if we go down to number 5 is where the herbal approach is, then you can click here and find out what's coming up. So here's the upcoming dates. And you can also click on the link and get to the replays. One quick reminder, our disclaimer that this is for educational purposes only. This is not medical advice. If you have a health issue or a condition or a concern, please seek out a healthcare provider because this is for educational purposes only. Here at Healthy Seminars, what we're doing during the time of isolation is we're putting out lots of content because we want to create community. We have physical distancing. We believe that does not mean social isolation. It's physical distancing, and we can still have social innovation and social solidarity. This is why your cameras are on. And at the end of the lecture, we unmute everybody so everybody can kind of connect to each other and say hi. So it's an opportunity to look through the pictures. If you look on the on your screen, you can hit an arrow and move the pictures across and see who's on. And at the end, you can kind of connect with each other. If you have a question during the lecture, please raise your hand digitally. At the bottom of your screen on a laptop, there should be a raise your hand or a participant icon. Click on that, raise your hand. If you're on an iPad, there is a more button, so you can raise your hand there. We'll give priority to those that raise their hand. You can also put your questions in the chat room. Sharon Weizenbaum is a friend, colleague, and a brilliant instructor. She runs the GMP graduate mentorship program, whitepinehealingarts.org. It's an excellent program. She has tons of courses on healthyseminars.com. The coupon is available during the month of April on all of her courses at healthyseminars.com. The coupon is healthy25, and she is a prolific writer, a prolific teacher, an amazing person, and a practitioner. And I'm very excited to say, Sharon, it is now your show. Take it away.
Okay. Thanks, Lauren. Geez, I'm blushing. I'm really happy to be here to introduce Allyson. I've known Allyson for so many years now. I don't know, maybe 10 years or something. And she's been studying in the graduate mentorship program, but also has been a TA helping students in the program with their case reviews that they present and we go over. So I've known Allyson and worked closely with her for a long time. And before we start, I'd like to also just add something about what we're presenting here, because we're looking at things through a particular lens of the Shanghanlun and a particular lens of how the body works. And just want to encourage everybody to consider, like, we have so much information coming at us right now about how to treat this, how to work with this in this time, and all kinds of different approaches. And it can be really dizzying. And so I think it's really good to listen in a way that's sort of like, what makes sense to me? Like, when I hear this, does it make sense? Does that give me some tool that actually resonates with me. And, that's what I think all of us in this series are really trying to offer, something that makes sense to us. Like, it really makes sense to me to work in this particular way. And I've been working with it for a while, and it continues to make more and more sense to me. So just see if it makes sense to you, then we're offering it. It's yours. And if other things make sense, then that's what's right for you. But I think what Allyson's going to be presenting is, her understanding of this really amazing formula, the Shurgan Huang Tang. So, just welcome to this wonderful Allyson Nevard. Yay.
Does that look right? All right. Well, thanks for coming, everyone. And thanks so much to Lauren and the team. I mean, for me, one of the silver linings of this whole crazy time is all of this learning that we're doing. Just like Sharon says, it's kind of dizzying and stressful, but it's also amazing and such a gift. And for Lauren and the team to be offering this to us, so much to us free, has been amazing. And I know we're going to come out of this with so much more knowledge than when we started. I'm also really honored to have the opportunity to be here, really humbled to be here, because I know there's so many really experienced practitioners out there from all over the world listening. And thanks to Sharon, because I never could have been here without her. And I'm so grateful just to feel like I have any kind of foundation, so much more solid of a foundation than I've ever had, thanks to studying with her for so many years. So let's get started. Okay, so I just wanted to briefly mention the Qingfei Paidu Tang, because that's really when Shurgan Huang Tang came into the spotlight for me. I didn't know much about this formula until I saw that it was part of this famous formula, going that was being used in China at the start of this whole virus. So there's, it's a huge formula, including so many formulas within it, so many Mahuang formulas in it, and most of them are almost completely the complete formula in there. The only things that end up getting taken out of any of these formulas are nourishing or restraining formulas. So it's so much acrid and bitter in these formulas. And Shurgan Mahuang Tang's in here completely except for the Datsao. The name of the formula almost suggests that it might be Huang Tang with Shurgan added. So I just wanted to quickly compare the two. You can see really the only similarity between the two is the Mahuang. And the main difference in these formulas is that there's so much phlegm involved. It's much more about the lung and phlegm and the throat than Huang Tang, which is more about just the frozen surface. So this formula, instead of getting its name from Huang Tang, it gets its name from this Duiyao pair of Shurgan and Mahuang that work together, two really opposite herbs that work together to open the lungs. Okay. So first we'll start by looking at the line in the Jingui Yaolui, where we first see, the only line where we see Shurgan Huang Tang. It's in chapter 7 on lung wilt, lung abscess, and coughing with qi ascent. Line 6, and it says, for coughing with qi ascent and a frog-like rail in the throat, Shurgan Huang Tang is indicated. So this for us is a really important line, because when we're trying to come up with the pattern, for which to choose a formula, we really look a lot to these lines in the Shanghan Zabing Lu. So doesn't she look miserable? Anyway, so for our first look at Shurgan Huang Tang, there are just a couple of things I wanted to point out. First of all, you can see that almost every herb in here goes to the lungs. Only Datsao doesn't go to the lungs. So we can tell right away by looking at it that this is really a lung formula. And also, all of the herbs except Datsao are either acrid or bitter. So it's a very opening formula rather than a supplementing formula. And we'll see that as we go on too. And lastly, all of the herbs in here except for Shurgan are warm. So it's a really warming formula. And so that's something else we want to keep in mind as we move along. So first I thought we could just start by familiarizing ourselves with some of the herbs in this formula. So we'll start with Shugan. In Bensky's Materia Medica, he says that Shugan is lung, bitter, and cold. It goes to the lung, is bitter and cold. It clears heat toxin, reduces swelling of the throat, and transforms phlegm. It clears heat, resolves toxicity, and improves the quality of the throat. For swelling and pain of the throat due to fire excess, fire toxin, or phlegm heat obstruction. Transforms phlegm and clears the lung for coughing and wheezing with phlegm obstruction. Its effect on phlegm is so strong that it is combined with warming herbs in treating obstruction and clogging due to cold phlegm. And then they mentioned Shugan Ma Huang Tang in there. In Eric Brand and Nigel Weissman's Materia Medica, they actually include cold phlegm congestion with phlegm rail and panting, or with cough and copious sputum as one of their indications for Shugan. The Shen Nong Ben Sao Jing says it's bitter, balanced, and toxic. It treats counterflow cough with a scent of qi, and that's a theme you'll see with all of the herbs in the formula. They all treat, or almost all of them treat, counterflow cough with a scent of qi. B impediment in the larynx and pain in the pharynx, an inability to breathe, scatters bound qi and treats evil counterflow inside the abdomen and severe heat from food and drink. And then the Wenbing actually mentions Shugan one time in chapter 10 on damp warmth, smoldering damp heat toxins. There's a formula, Ganlu Xiao Du Dan, sweet dew toxin dispersing elixir. And it transforms dampness and clears heat, resolves toxins, and disinhibits the throat. Shugan is in there to disinhibit the throat and disperse swelling. Shugan is really known as a throat herb. Anytime you see doctors adding Shugan into formulas, it's almost always for the throat. Dr. Yu, when you go through his books, he mentions it a few times, and it's always when there's this throat swelling, severe sore throat. Zhao Shuda, anytime he uses this formula, it's for tonsillitis. He also one time adds it for splenomegaly, which we'll see because on the next slide, I'm going to talk about how Zhao Shuda sees Shugan. He says Shugan is cold in nature and bitter in flavor. Its main actions are to clear heat and resolve toxin and disperse swelling and dissipate binds. For a sore, swollen throat, for phlegm and heat binding together and blocking the throat, causing a sore, swollen throat, phlegm that is not easy to expectorate, phlegm that sounds like the rasping of a saw, and difficulty breathing. Use this to clear lung phlegm heat, to disperse swelling and dissipate binds, and to disinhibit the throat. Shugan is primarily medicinal for treating throat impediment and sore throat, for lung heat, panting, and cough, and phlegm rail in the throat. And he also mentions it for concretions, conglomerations, strings, and aggregations in the abdomen, for accumulated phlegm and static blood in the abdomen that binds and forms strings and aggregations, including hepatosplenomegaly. And then he compares it with Mabo, the puffball, where he says Mabo clears and dissipates lung heat and thereby disinhibits the throat. It is used for non-diffusion of lung qi that results in cough, sore throat, and loss of voice. Shugan drains repletion heat in the chest and disperses phlegm and dissipates binds to disinhibit the throat. It's used for exuberant heat and phlegm bind, causing cough, swollen throat, and frog rail in the throat. So Mabo is acrid and light and goes to the surface for more of a wind heat-like sore throat, and Shugan is bitter and a root, and it drains the lung and for a heat in the lung or Yangming block in the chest. So Sally already talked about Ma Huang quite a bit, but I just wanted to mention it briefly again here because it's such an important component of this formula. It activates the yang to unblock a frozen exterior and induces sweating. It disseminates and facilitates lung qi to calm wheezing and stop cough. And as a hollow tube, it opens the surface to promote urination and reduce edema. So we know Ma Huang to be a stimulant, really activates the warm yang out to the surface of the body in an energetic way. So Shugan and Ma Huang as a Dui Yao pair The properties when combined, one is warm, the other is cold. One diffuses, the other downbears. When the two medicinals are combined together, they combine the diffusion and downbearing methods. Together, they diffuse the lungs and downbear the qi, disperse phlegm, and calm asthma. The major indication is asthma and asthmatic wheezing due to accumulation of phlegm room that blocks the circulation of lung qi, which then counterflows. For these indications, this combination is found in Shirgan Huang Tang. Shirgan is the key medicinal substance for the treatment of throat inflammation due to heat toxins, together with accumulation of phlegm in the throat. Together with Mahuang, Shirgan expels phlegm accumulated in the lungs and throat, causing cough or asthma with stertor and asthmatic wheezing. So I put all this in here just to really show that Shirgan is really a throat herb. It treats phlegm in the lungs, but I think the main reason why it's in here is we'll see this formula when we want to think about this formula is when there's a lot of phlegm in the throat. Okay, Guangdonghua, coltsfoot flower, goes to the lung, is acrid and warm. The Shennon Bensao Jing says it's acrid, warm, and non-toxic, treats counterflow cough with a scent of qi, tendency to panting, the impediment of the throat, all sorts of fright seizures, and the evil qi of cold and heat. Brandon Weissman say because it's acrid and warm, Guangdonghua disperses qi and assists heat. It should be used with care when treating cough with expectoration of blood or pulmonary welling abscess with expectoration of pus and blood. Guangdonghua is a spring flower that grows along the waterways. And Sharon likes to talk about how it's yellow. The outside is purple, but the inside is yellow. So it kind of grows from the water up towards the fire from north to south and helps to work with the fluids that way. Zhao Shude talks about Guangdonghua. It's acrid, slightly bitter in flavor, and warm in nature. Guangdonghua warms the lungs and transforms phlegm, suppresses cough, and calms panting. When mixed fried with honey, it moistens the lung. Guangdonghua is a commonly used medicinal for cough. Using a paper tube to inhale the smoke of burning Guangdonghua also treats cough. In Shirgan Huang Tang, this medicinal dissipates cold and transforms phlegm with warmth and acridity, as well as downbearing qi and calming panting with slight bitterness. I often use Guangdonghua to moisten the lung and suppress cough for enduring cough or taxation cough, usually in combination with other medicinals. Guangdonghua tends to treat cold-natured cough, so for fire-heat cough, it is inappropriate. Sharon actually went out the other day and was harvesting Guangdonghua on her farm, and she took a little video for us to watch. Oh, here it is. You can see it right on the side of the waterways.
Here's the coltsfoot growing along the water pathways. Just at the perfect time to harvest.
Isn't that great? They look like dandelions. Okay, Zerwan, purple aster root, goes to the lung, is acrid, bitter, and slightly warm. Bensky said it's acrid, dispersing, bitter, draining, yet warm, and moistening without drying. Stops cough, facilitates urination, enters both the qi and blood aspect, relieves cough and expels phlegm, an important herb in stopping coughs of various etiologies, including wind cold, wind heat, lung deficiency, and consumption. Brandon Weissman say it's actually sweet, bitter, and slightly warm. Moistens the lung, transforms phlegm, and relieves cough. Zerwan is sweet and moistening as well as bitter and discharging. It is warm but not dry and enters the lung channel. These properties make it good for moistening the lung and downbearing qi while transforming phlegm and relieving cough. Such a good herb for what we're seeing now with these phlegmy coughs where you can't cough anything up. Zhao Shude says Zerwan is acrid yet not drying, moistening yet not cold, supplementing yet not stagnating. Therefore, it is frequently used to treat cough, regardless of whether a result of internal injury or external contraction, in formulas that are varied according to the signs. So Guangdonghua and Zerwan are often used together in this pair where they mutually bolster each other's effects. There's this really cool book out there called Braiding Sweetgrass by Robin Wall Kimmer, who's a botanist, and also she's Native American and just grew up a plant lover. And so she talks about how she has a chapter in there on goldenrod and asters, which grow together because those are both fall herbs. Goldenrod is a fall herb, and then zerwan is a fall herb. And so she talks about, she always wondered why they grew together. And over the years, she found that actually they grow together because the two colors make each other more beautiful, not only to our eyes, but to the eyes of bees. And so they've noticed that when they grow together, bees come to them for pollen more often than if they were growing separately. She has this great quote in there about purple and yellow, which are two complementary colors, as different in nature as could be. In composing a palette, putting them together makes each more vivid. Just a touch of one will bring out the other. Oh, I thought that was really cool because one is more acrid and the other is more bitter, but each of them contain both flavors. And so they each bring out the weaker quality of the other. Zhao Shudu talks about the pair by saying, Zerwan tends to treat cough by diffusing the lung and transforming phlegm, whereas Guandonghua tends to treat cough by warming the lung and transforming phlegm. These two medicinals are frequently used together in order to increase the capacity to treat cough. According to modern research reports, whereas Zerwan has no significant antitussive effect, but a pronounced expectorant effect, Guandonghua has no significant expectorant action, but a pronounced antitussive action. Guandonghua tends to warm the lung and is mostly used for cough from wind-cold-natured phlegm rheum. Zerwan tends to open and dissipate lung qi depression and is mostly used for cough from wind heat depressing the lung. Okay, we all know about Bansha, but mostly I wanted to bring to our attention how Bansha is very much a throat herb. So the Shennon Bensao Jing says it's acrid, balanced, and toxic, treats cold damage, cold and heat, and hardness below the heart, brings down the qi, treats swelling and pain in the throat, dizziness in the head, distension in the chest, counterflow cough, and intestinal rumbling, and stops sweating. Brandon Weissman talk about it as acrid and warm, dries dampness and transforms phlegm for cough and panting due to damp phlegm and cold phlegm, downbears counterflow and checks vomiting, disperses swelling and relieves pain, which I think they mean in the throat. And Huang really stresses Bansha as a throat herb. He says it can treat symptoms of vomiting with no thirst, sore throat, loss of voice, a feeling of a lump in the throat, cough and panting and palpitations below the heart. And we all know Bansha Hopo Tang and Bansha's ability to affect the throat there. But it also can be a guide to the throat. Wu Weizhe is indicated for boosting qi, counterflow cough with qi ascent. Bensky talks about it as containing the leakage of lung qi and stopping cough, grasps the qi, enriches the kidney, stops diarrhea, nourishes the liver, quiets the spirit, and generates fluid. And then he quotes Cheng Wuji, the lungs favor restraint. When acutely ill, consume sourness to restrain lung qi dispersal. The sourness of Xiaoyao and Wu Weizhe restrains rebellious qi and quiets the lungs. So obviously that's when it's in combination with the acrid herbs and bitter herbs that treat the cough itself. You wouldn't give the sour flavor on its own. Xixin, the Shennon Bensao Jing calls it fine acridity, acrid, warm, and non-toxic, treats cough with counterflow, headache, hypertonicity in the 100 joints, wind and damp, related bee impediment pain, and dead flesh. Consumed over a long time, it brightens the eyes, disinhibits the 9 orifices, lightens the body, and lengthens the years. It's powerfully aromatic, warm and piercing, disperses cold from both great yang and lesser yang, opens the orifices, relieves pain, and reaches the head, lungs, bones, and joints to disperse wind, cold, dampness, and phlegm. Wu Weizi and Xixin are a pair in that Wu Weizi is sour, warm, and specifically used for contracting and preserving. It's particularly good at restraining the lungs and alleviating cough. Together with Xixin, whose acrid dispersing properties open the lungs, the sour restraining quality of Wu Weizi preserves the lung qi. The first herb opens the lungs without risk of exhausting qi, while the second herb closes the lungs without risk of mistakenly trapping the pathogenic qi. Thus, the pair is ideal for regulating the opening and closing of the lungs, alleviating cough, and calming wheezing. It's used for patients with existing thin mucus who are further exposed to externally contracted wind cold, leading to acute wheezing and coughing up of thin, clear sputum. It says, for a new cough, use more Xixin, and for an old cough, use more Wu Weizi. I think this is from the Eastland Press app, too. Shengjiang, I just really want to mention how Sharon talks about Shengjiang. We know that it's a stomach herb good for nausea, but it's the kind of nausea where there's thin fluids in the stomach causing the nausea. She talks about Shengjiang as having a quick action, like sweeping a puddle of water out of the stomach. And it's an herb that it sweats. They talk about it's kind of sweating the water out of the stomach, or bringing the water up from the stomach out to the surface in a sweat. So Mahuang and Shengjiang are another pair, both acrid, warm exterior releasing herbs. Mahuang has a stronger sweat-inducing action than Shengjiang, but this effect is markedly improved when the two herbs are combined. Shengjiang also contributes to a lung warming action, to Mahuang's ability to spread and disseminate the lung qi, as well as calming the stomach and reducing nausea. Thus, the pair is indicated for all externally contracted wind-cold disorders, especially those in which the wind-cold has constrained the lung qi, leading to cough and wheezing, and the failure of the lung qi to descend has allowed the stomach qi to rebel upward, causing nausea and vomiting. So we have Shengjiang and Mahuang as a pair, also Shengjiang and Bansha. Anytime those are together in a formula, we know that formula can treat nausea and vomiting, and so Shengjiang Mahuang Tang can treat nausea and vomiting. Datsao supplements the center, boosts qi, and it harmonizes the other medicinals and protects the middle warmer. And together with Shengjiang, Sharon talks about this, like with Guizhi Tang, how Shengjiang, that warm, acrid Shengjiang in the middle with Datsao and with Zhigansao, which is not in this formula, but in this formula it would be Shengjiang and Datsao, how you can visualize it like almost Shengjiang's cooking the Datsao to produce this moist steam that goes up and out to the surface of the body. So it's creating this up and out motion of a nice, warm, healthy steam. So another look at Shengjiang Mahuang Tang, we can see with all the pairs that I just mentioned, the whole formula is really about this upward and downward motion. The acrid and the bitter working together to resolve the surface, and also to open the yang ming for the downward motion. So here's the pattern. This is how we'll know that Shengjiang Tang is indicated when somebody comes in looking like this. So again, the Jingui Yaolei, line 6, for coughing with qi ascent. And now that we've seen all of these herbs are indicated for coughing with qi ascent, and a frog-like rail in the throat, Shengjiang Mahuang Tang is indicated. So for the pattern, we see that the exterior is unable to fully resolve due to cold damage. And we know this because there's Mahuang and Shengjiang and Xixin in there, all warmly go to the surface of the body. There's damp phlegm in the lungs and throat that makes rail-like sounds. And we know that there are a lot of herbs in the formula for damp phlegm. If we look back, we see that Shengjiang, Zhewan, Guangdonghua, Bansha, Xixin, Shengjiang, and Mahuang, a little bit, are all for damp phlegm. And it talks about the throat because Bansha, Guangdonghua, and Shengjiang are all throat herbs. There's stagnation and heat starting to develop in the chest and throat, and the fluids are starting to thicken. So rather than there being all this cold dampened phlegm that's easy to come out, the fluids are starting to get a little thicker. And so part of what you see with this patient coming in is that they have all this phlegm in their throat and chest, but they can't get it out. So it's almost like a choking phlegm cough. And so it's a Tai Yang Yang Ming pattern. A lot of people talk about this as a Tai Yin Yang Ming pattern, and we'll go into why we think it's more of a Tai Yang Ming pattern. So if you wanted to do a TCM Zong Fu diagnosis, this would look like damp phlegm in the lungs with heat starting to develop in the lungs and a cold strike or wind cold on the exterior. So here we're going to talk a little bit about our 6 confirmation physiology, which is one of the things I love most about Sharon's class is how with everything we look at the physiology and see what's really going on in the body. So hopefully my understanding of this is right. But as far as something to keep in mind with the confirmations, and I'm mentioning this as a way to explain why we're not calling it a tie-in pattern. Is that the organs in the Yang confirmations, so the Tai Yang, Yang Ming, and Xiao Yang, the bladder and the small intestine, the stomach and the large intestine, and the triple worm and the gallbladder, they're all hollow tubes. And so these Yang organs are passages through which the environment comes in and out of us. And so as hollow tubes and passages, they can get blocked. And that's what their pathology is blockage and excess. They can't really be deficient. It's not like you would want to nourish a hollow tube. When there's dysfunction in any of these conformations, it's because there's a blockage with stagnation and heat starting to build. And then for the Yin conformations, these are about storage. They're solid organs. And so we don't look at them as really being able to be excess. We look at them as needing to be nourished. And so when we're determining our pattern, we're deciding what are these herbs doing? Are they opening or are they nourishing? Are they helping the body absorb and hold on to nourishment, or are they helping things pass in and out? And so in the Shurgan Huang Tang pathology, we see that the Tai Yang is blocked by cold so that the Yang is unable to come up all the way and out. And so the Yang Ming is blocked in the chest, so our Yang is unable to properly descend, and signs of heat and stagnation are starting to develop. And here, this is the wheel that Sharon was using in her presentation, but we see how these conformations are cyclical in motion in our body. It's not a linear coming from out of the body and down in one after the other. We look at the physiology as the imperial fire coming in from outside of us, down through the body, into the Shaoyin, becoming the Mingmen fire, and then going back up and out all the way to the surface. So I made this little picture of the 6 confirmation physiology, what it might look like in the body. And so you see here with these snowflakes, these are, the surface is frozen. And so this red arrow here is the Tai Yang trying to come up and out in its normal physiological action, but it's hitting this blockage of cold at the surface and it can't fully resolve. It can't go all the way up and out. And then we have the imperial fire coming down, coming in from the outside, from heaven, down into the body. And for some reason, it is getting trapped in the chest. And maybe that's because there are all these phlegm fluids in the chest. And so it can't go all the way down to the lower warmer like it normally would. And so instead it starts to come back up. And this is a little bit about the counterflow, the chi ascent that they're talking about, and that Zhangzong Jing is talking about in the pattern. And so the Yang Ming kind of almost bounces back up and stays in the upper warmer. And so things are starting to stagnate and get a little warm. It's carrying some of the fluids up with it in this particular pattern. And so the fluids are in the starting to be in the throat, and they're getting thicker. I also have a little bit of dampness in the middle warmer down there because we have Shengjiang there, but this pattern is not really treating the middle warmer at all. It's a lung pattern. So now I wanted to help us get an idea of when we would choose this formula, compare this formula with some of the other common formulas we're using these days with this virus. So we see Shigan Ma Huang Tang is a Taiyang Yangming pattern, a frozen exterior with damp phlegm in the lungs and lung heat starting to develop, Yangming heat starting to develop. Sharon talked about Mashing Shigan Tang last week as a Taiyang Yangming pattern with cold on the exterior and lung heat developing. So there's not the phlegm in the lungs that there is with the Shigan Ma Huang Tang, with the Mashing Shigan Tang pattern. Also, it has the higher dose of Shigao in it. So the sense of stagnation in the lungs and maybe heat would be greater here. There'd be, a lot of that people talk about feeling like an elephant sitting on their chest, deep stagnation without a lot of phlegm. And the exterior is still involved, you would think of Mashing Shigan Tang. Shigan Ma Huang Tang is in the Bensky's Materia Medica and listed under Shaoqing Long Tang as a subcategory of it. And Shaoqing Long Tang is often looked at as a Taiyin formula with frozen lungs and exterior. But I also want to say here that we wouldn't really call Shaoqing Long Tang much of a Taiyin formula either. And the reason why is because it's also so acrid with a little bitter. It's all about going up and out. And so a Taiyin formula, because it's a yin conformation, it's something that would need to be nourished. And so here we have Ma Huang, Guizhi, Ganjiang, Xixin, all warm, acrid herbs. And I think sometimes people call this a tie-in formula either because there are fluids involved, and so they automatically say when fluids are involved, the tie-in's involved, because we know that dampness originates in the middle warmer often. But you can only say that the tie-in is involved in a pattern, formula pattern, when you're treating the tie-in, and you're treating the tie-in when you're nourishing the tie-in. So if you had dampness and you were treating it with a tie-in formula, it would be a formula that would be including Baiju or Fuling or Huangqi, which are spleen strengthening herbs that help the spleen absorb the dampness or process the water properly so that it's not coming out pathologically. And so also we see, like in Shigan Ma Huang Tang, we have a little bit of Wu Weizi in there to help protect the lungs during this coughing, and also with the use of these acrid herbs going up and out to the surface. And in Shaoqing Long Tang, we have Bai Shao and Wu Weizi in higher doses. And so we can see that the cough would be worse here. I think Shigan Ma Huang Tang is more of a phlegm in the throat and chest formula with some cough, but more about the phlegm. And Shaoqing Long Tang has a lot of watery fluids and much more coughing. Shaoqing Long Tang, because the lungs are frozen, the fluids are a lot more watery. They're not thickened by any heat in this formula, and they come out easily, vomiting fluids or runny nose or watery eyes or puffiness everywhere. And so lastly, Bansha Hopo Tang is a Taiyang Taiyin formula, damp stagnation in the lung and throat. We see we have Bansha Hopo, we have Shengjiang and Zituye as Taiyang herbs, and then Fuling is what makes this have Taiyin as part of the pattern, because Fuling is helping the spleen absorb fluids and drain them out through the urination. Oh, there's that. And I wrote up here Da Qing Tang because I was going to add that in. But that's really a Ma Huang Tang pattern that also has Shi Gao in it. And so it's a lot more of resolving the Tai Yang, a lot more up and out, strong up and out action, and some serious Yang Ming block in the chest as well. So now we'll talk about some different doctors' explanations of Shurgan Mahang Tang, how they view it. All of these were translated by Sharon in her ebooks that we get when we're in the class. And you'll see through these and some of the cases that I have here also that we really start to get a good sense of this formula when you see how doctors talk about it and use it, treating people. So Hu Shishu says, Shurgan Mahang Tang primarily treats the following. There are respiratory system illnesses such as cough with panting, cough is less, panting is more, abundant phlegm stuck in the throat, blockage of the qi mechanism, water bird-like sounds in the throat, ascending phlegm, wheezing, cough. This may be acute upper respiratory tract infection, bronchitis, or allergic type bronchial asthma, chronic bronchitis, pulmonary emphysema, or whooping cough, or the virus that has no name. Hu Shishu continues to say that this formula spreads the lungs downward, transforms phlegm, disperses phlegm, and calms panting. It is similar to the application of Shaoqing Longtang. The primary herbs are Ma Huang combined with Wu Weizhi, Bansha, Xixin, and Ganjiang. Because Shaoqing Longtang is for externally contracted inner fluid with abundant watery phlegm that is easy to vomit out, serious shortness of breath without being able to lay flat. It also has Guizhi to warm the yang and transform fluids, as well as to return the correct. This formula treats phlegm that is abundant and relatively thick and easy to cough out. The phlegm accumulates in the throat so that there are water-like sounds like a frog or bird. This is a situation in which there is transformed heat. This is why Shurgan is added as well as Donghua and Zhiwan. These dispel phlegm and disinhibit the aperture. Zhiwan has the ability to dispel the evil. Guizhi Jiahopo Xingzi Tang treats external contraction with panting or qi surging upward and aversion to cold. There is no mouth dryness or mouth thirst. Ma Xing Shurgan Tang treats panting and the pattern appears with internal heat, dry mouth, without a fear of the wind blowing. There is often a tendency to fever, and this appears in children often. When there is cough and panting that tends towards cold, the phlegm fluid is watery, and one uses Shaoqing Longtang. This is often seen in older people. When there is cough and pant with abundant phlegm-making sounds, use Shurgan Mahang Tang. This is accompanied by chest fullness and thirst. So here's a Hu Shishu case study. Acute allergic bronchial asthma. So the patient was 28 years old, a 28-year-old woman who suddenly developed asthma. She went to the hospital for treatment and then was transferred twice to other hospitals. She ended up at the Wuxi-run People's Hospital. She ended up spending more than 10,000 yuan. She took hormones and inhaled atomizers, but the asthma continued. She was brought in, supported by her father. She had normally been healthy with a robust body. Then the asthma symptoms came on during the consultation. She had difficulty breathing, and there were loud water sounds. Her lips were dark. Her tongue moss was white and sticky as well as dry. Her pulses were thin and rapid. I recommended she go to the hospital, but her father said, "We've been in hospitals for the last 3 days, but everything is the same. We want to use Chinese medicine." I immediately went to the acupuncture department and fetched a silver needle. I pierced functure and Dazwei, and in a minute the asthma decreased and stopped. The chest fullness dispersed. The father said, "This was as fast as breathing oxygen or the atomizer. I am overjoyed." I gave her 2 packages of Shurgan Mahang Tang, decocted in water, taken twice daily. You can see here he added Jaegung and Jinyinhua in here, but otherwise it's the full formula. So there must have been more heat if you're going to add those herbs. For the second illness, the illness had not returned. I gave her 5 more packages of the same formula. The third visit, there was no more illness. I removed Jinyan Hua from the formula and gave her another 5 packages. Because she had breast distension and pain and her menstruation was scanty, I gave her Guizhi Fu Lingwan and she returned to her work unit. I did follow up over the phone and she was cured. So I wonder if everybody looking at this would have thought that Shigan Ma Huang Tang would have been indicated. For me, it was that there were loud water sounds, and that the phlegm was sticky. Her tongue moss was white and sticky as well as dry. And so it was not a big watery presentation, but there was sounds. Okay, and now for Functional explanation of Shigan Ma Huang Tang. This is an external evil with internal fluid, cough, and pant. We can differentiate this from Shaoqing Long Tang. Both contain Ma Huang, Dazao, Wu Weizi, Ban Sha, and Xi Xin. Both have a pathomechanism of external evil with internal fluids. They both treat cough and panting. However, Shaoqing Long Tang contains Guizhi, Baishao, Ganzhang, and Gansao, while Shigan Ma Huang Tang contains Shigan, Ziwan, Guangdonghua, and Shengjiang. From this, we can see that Shaoqing Long Tang pattern stresses the exterior and the interior deficiency cold is also extreme. On the other hand, Shigan Ma Huang Tang pattern has a relatively light deficiency cold presentation and there is slight upper heat. There is also wheezing or inhibition of the throat as principal signs. The target of this formula is the inhibited throat, and so it should be differentiated from Basha Hopo Tang. The 2 formulas both are based on Xiao Bansha Tang. They both treat inhibition of the throat, vomiting and nausea, and both treat an external evil with internal fluids pattern. Bansha Hopo Tang uses Xiao Bansha Tang as a base and adds Hopo, Suzhi, and Fuling. Hopo and Suzhi treat qi stasis, and so they treat abdominal distension and emotional symptoms. Fuling treats inhibited urination and heart palpitations and vexation. On the other hand, Shigan Ma Huang Tang uses Xiao Bansha Tang as a foundation and then adds Ma Huang, showing us that there is more focus on resolving the exterior. The addition of Shigan, Dazao, Wu Weizi, Ziwan, Guangdonghua, and Xi Xin is a large contingent of dispelling phlegm fluid herbs, increasing the strength of the formula to dispel fluids. The 2 herbs, Shigan and Guangdonghua, both disinhibit the throat, and so they treat phlegm sounds in the throat. To sum up, Shigan Ma Huang Tang is in the category of a combined Taiyang, Yangming, and Taiyin illness, which we are not agreeing with that last part. It is external contraction with internal fluids, with fluids rebelling upward and knotting in the throat. Internally, the deficiency cold is not extreme and there may be slight heat. The focus of the clinical application is the following: cough and pant with phlegm wheeze and upward moving qi, external evil with internal fluids and phlegm fluids heavier than in a Bansha Hopo Tang pattern. External symptoms are less than in a Shaoqing Long Tang pattern. Then internal and external are both not extreme and there is slight heat. So here's a functional case. Mr. Zhang, age 56, he had cold and panting for 1 month with a dry cough and no phlegm. His labored breathing was worse with cold and with laying down. When he panted, he also sweat. He could sleep on his side. His mouth was harmonious and there were wheezing sounds. Urination was fine, though he got up to urinate 3 to 4 times at night. His tongue moss was white and sticky and his pulses were thin and wiry. He gave him Shigan Ma Huang Tang. After the herbs, his asthma was cured and I did not give him more herbs. The discussion says, cough and panting with ascending qi, phlegm sounds in the throat, panting worse with cold, and accompanied by sweating show a slight exterior pattern. This is the Shigan Ma Huang Tang pattern. So when you read above, Shigan Ma Huang Tang might not come to mind, but in the discussion he talks about how there are phlegm sounds in the throat. So I don't know if that was missing in the formula, and I think that would be one of the main indications. One more functional lung. We only have a couple more left. I'm almost done. Mr. Ma, age 54, came for a consultation on June 22nd, 2015. He had heart palpitations for more than 10 days. He often could not sleep. At the end of 2014, he had surgery to replace his hip. He had a history of asthma, and since the surgery, he had cough and panting with abundant phlegm that was white and sticky. He did an inhaler 2 to 3 times a day and used a lot of pillows in bed. After the inhaler, he could lay flat. He drank lots of water and sweat a lot with night sweats. He had no aversion to cold, but did have poor appetite, unformed stool, and white sticky moss at the back of his tongue. His pulse was thin, rapid, and wiry. So here you see he gave Shirgan Ma Huang Tang with Chen Pi and Shirgao added. Second visit, July 3rd, 2015. His cough and panting had decreased and the phlegm had become less. He used his inhaler only 1 time each day. His mouth was dry, stool unformed, and drinking was less. I gave him 7 packages of the formula with Shishin increased to 10 grams. Discussion. Cough and panting with abundant phlegm, poor appetite, and a sticky root moss indicates extreme fluids. The phlegm color was white and sticky, which indicated that the cold was not extreme. The desire to drink a lot indicated heat. The spontaneous and night sweats indicated a pattern of external cold with internal heat. This was Taiyang Yangming and Taiyin combined pattern. It was Shirgan Ma Huang Tang with added Shirgao to clear Yangming heat and Chen Pi to transform phlegm. Compared to Xiao Qing Long Tong pattern, the exterior pattern was relatively light. Compared to the Hopo Ma Huang Tong pattern, the phlegm was relatively serious. Although there were no throat sounds, this formula will still be effective. Then I have one colleague who I know of that used this formula for somebody who came to her with this current virus. And actually online I saw a couple other people use it, but I never found out the results of those cases, so I didn't put them in here. But I definitely think this formula is something we could use now in the current conditions where you see a lot of phlegm and you can't cough it up. It's that stagnant phlegm that's kind of choking. And oftentimes I think we would need to add Shirgao in here if the stagnation in the chest got much worse, or if you saw a lot of thirst for cold beverage or heat symptoms. So this is my colleague's patient, female in her late 30s. Asthma was a precondition, and she had obesity. She was diagnosed with the virus in late February. At the time of this intake, she was on day 25 with it. Her current symptoms: wheezing sound in her chest and throat, rattling-like sound that could be heard on the video during the intake. She was coughing up scanty, clear phlegm, but also had dry, sticky, rubber-like phlegm that was coming up occasionally. She was happy to be coughing up some phlegm at this stage. She has pain around her ribs that wraps around to the back. Her face is swollen and feels puffy, especially under her eyes. Her hands were also puffy and having a hard time getting her rings off. She has some thirst for warm drinks, but not overly thirsty. Sweating is normal. Her tongue was pale and slightly indented, normal thin white coating. And this person gave her Shirgan Ma Huang Tang with standard dosages, and her breathing cleared right up. This person was a complicated case. She didn't start out a Shirgan Ma Huang Tang pattern, but my colleague was treating her successfully, but then the doctor gave her steroids and it made her worse. And I think maybe that's where some of the lung heat developed, thickened her fluids and made her more stagnant. So anyway, that's it. That's all of my presentation.
Allyson, thank you very much. That's lovely. You know, it just shows, for those that have been watching these Herbal series, what a great group the graduate mentorship program people are, right? They're just sharing such great information.